Brain injuries, especially sports-related, have become a hot topic of late, and March is Brain Injury Awareness Month. Dr. Nick Holekamp is the Chief Medical Officer at Ranken Pediatric Bridge, and he joins us this morning to talk more about it. Thank you so much for being here.
Thanks, Ken.
It's a pretty serious discussion because I know a lot of parents are concerned about sport injuries, but there are also some very traumatic brain injuries that occur outside of sports as well, and unfortunately you have to deal with those at Ranken at times.
Right, at Ranken we deal with the most serious kind of brain injuries. The less serious ones, a lot of preventive measures, obviously wearing helmets, wearing seat belts, but some of those are not preventable, and Ranken helps those kids and their families recover from the most serious types of injuries.
Give us the short version of what you want people to know about brain injuries.
Well, every patient is different. There are common themes, and there's not a whole lot we can do to prevent the problems that brain injuries cause, but how we manage them. And I think we have an innovative approach that customizes care. Brain injury recovery is not a passive process. It's not waiting for the brain to get better. You have to stimulate these kids to the extent they're able to tolerate, give them activities and lots of intensive therapy, the right kind of medications, managing their environment, and then supporting the family through the recovery is really a key. And
I know we're talking about the more serious brain injuries, but there are some, when there's trauma, when there's physical trauma, that it's pretty obvious that there's going to be a brain injury. But a lot of times these brain injuries can actually be hidden from the parents and don't show up until a little later on down the road.
Right, and those are challenging to manage, and symptoms can be subtle.
Right.
We're developing a concussion clinic for those sorts of injuries as well. That's going to come online fairly shortly. But the kids who come to us often in a coma, I mean, they are not responsive at all. It's a matter of watching for little signs of progress to emerge and then build on that. The speech and occupational and physical therapists, all sorts of therapies, music therapy and art therapy, ways to get into the recovering brain to help maximize a child's recovery potential.
But first, in these major injuries, I mean, you've got life or death situations to get past before you can even start to focus on recovery of the brain function.
Absolutely, and I think that's where the promise of brain injury is, that's where my money is on preventing what's called the secondary injury. There's the impact that causes the obvious bruising, but then there's secondary injury of swelling that causes decreased blood flow. The great research, even here in town at Children's, doing work to prevent the downstream complications by controlling those first hours. That's where the promise is.
Yeah, and there's no, my script says there is no magic pill, obviously, and like you said, every injury is different and takes a different approach.
It's customized care, absolutely.
Yeah. Thank you so much for being with us.
Absolutely.
We really appreciate it. For more information about Ranken Pediatric Bridge Hospital, check out the website, rankenjordan.org. Give them a call. They look for volunteers over there, too. They'd love to have your help over at Ranken Jordan. 314-872-6400. Some remarkable stories come out of this place every day.
Yeah, thank you very much.